Well, going from the heart to the head, huh? Okay. I guess Santa's a super smart guy. Well, anyway, I was supposed to talk today about TIA. And when I first looked at that yesterday, it struck me, the tide is awesome. Is that what this talk is supposed to be about? College football? No. The tide is awesome. Oh, okay. No, all right. Well, I think it's more about transient ischemic attack, which is a brain syndrome. And so we're going to talk about that. It's kind of a warning symptom to a stroke. And unfortunately, South Carolina leads the planet in stroke, like would lead in a lot of bad categories, but unfortunately. So anyway, we're going to be talking about TIA, transient ischemic attack. So transient, temporary, and attack, what Nick Saban does on the football field. But also ischemic is lack of blood flow. Ischemia means suddenly an artery up in the brain is plugged and doesn't have any blood flow. The part of the brain downstream immediately stops its function and becomes stunned, but not yet dead. Dead would be a stroke, but TIA is just stunned, still alive, salvageable. So that is usually caused by a clot that's either forming right there in that brain artery or sent there from part south, sent there from the heart, the aorta, the major artery right after the heart, or the arteries in the neck. But a lot of diseases can sort of be zapping out an artery unbeknownst to somebody for a long time, and then finally on one day the day before it was 99% blocked from from risk factors, smoking, diabetes, high cholesterol, hypertension. But on that one day, that atherosclerosis becomes totally plugged with a little platelet clot, and then the person feels it with some type of symptom. Now, we like some of these acronyms like FAST that the American Stroke Association tries to get out there, like FAST, facial droop, arm weakness, speech difficulty, and then the T is time, meaning it's time to call 911. Okay, and forever people in America would just kind of wait on somebody to languish like 3 days and say, oh, they just slept wrong, they're going to be fine, they're going to be better, let's just give them a couple days. No more do we do that, because time is brain, and stroke has the potential to be cured in this day and age. The good drug that cardiology has had for decades is now available to neurology, and that's probably about the last 15 years even. But a drug called TPA can be given at an ER, tissue plasminogen activator. It can be given at the ER, shot into somebody's vein that's having a stroke, zoom up to the brain and dissolve the clot and be a cure. And we like that word. It's even our favorite. Other people it's love or free, but cure, yes. So anyway, we don't really give our patients anything but about 5 to 10 minutes on some information pages that we give, saying that if this symptom is going on past that point, that they should call 911 and never even try to make it to the ER by driving. It's a stroke. It could worsen en route, make the person lose consciousness, and then crash and die. But if they'd only got to the ER, they can get that drug and be cured. And on calling 911, they're there within a few seconds. They start working on your stroke in their vehicle, and then potentially at the ER after you get kind of a workup, kind of a super fast workup, a lot of blood testing, EKG, CAT scan, but potentially you could get that drug, and it can be a miracle drug. So we We love that drug a lot, and we don't like to take any more kind of a negative or nihilistic attitude towards stroke anymore. But we had to way in the past, but thank God we don't in this day and age. TIAs typically last only a few minutes, but they're supposed to last under 24 hours, okay? But these are, like I said, usually little clots that form in an artery, either a small one or a large one, and form there in the artery, that's called in situ thrombosis, or sent there, that's called embolism, like from the heart, maybe a heart condition called AFib, which stands for atrial fibrillation. In that disease, a chamber of the heart is just quivering like this, but it's supposed to go boom, boom, boom. Well, when it just quivers, blood doesn't move. It stagnates there, forms a clot, and then it ships up north to the brain. Now it can ship south to the kidneys or the legs, but this is a brain talk. So, but that condition is an infamous one to sort of unite cardiology and neurology, because it's infamous for causing strokes. Some people with their first TIA have never had AFib before, and they suddenly have a deficit, slurred speech, weakness on one side of their body, maybe a change in vision as well. But what they first noticed was severe palpitations. Well, that was AFib just starting. The blood stagnated, it shot north, and they're stroking. So the TIA is a big warning symptom or warning sign, and it needs to be heeded. A little bit about AFib, it's a good day to have that. I mean, if you have to have it, you want to avoid all disease, but it's a really good day because an old bad drug was the only thing to treat it in the past, called Coumadin, and you were tethered to your doctors a lot with that drug. A zillion blood draws had to be done, but now there's drugs that don't need any blood work. You just get on them, and they're even better at preventing stroke than Coumadin was. Don't have the dietary restrictions of Coumadin. These are drugs that are advertised: Xarelto, Pradaxa, Eliquis. So that's a great thing in cardiology and neurology as well. Now, so some of the diseases that can cause TIAs and stroke, we talked about the big ones: hypertension, diabetes, smoking, and high cholesterol, and diabetes. Now, a lot of other diseases can cause stroke, though, and then we get into those at the ER. Atrial fibrillation is one of them. You could have a hole in your heart to lead to a TIA or stroke. That's called patent foramen ovale, and it would be a way where a stroke, say, in a young person that had some trauma and had a clot form in a vein of their leg, could break free from there, travel north, usually be headed to the lungs, get diverted by this hole, and make it up to the brain. That's called paradoxical embolus. And then, so we would look for that in certain settings. Now, stroke or TIA mimics that we need to watch out for. Not everything that suddenly has a deficit at the brain is TIA or stroke. So if somebody has a seizure and it's unwitnessed, could it look like a stroke? It could, because that area of the brain is electrical just as much as it depends on blood flow. So it might just give up the ghost for 4 hours following a seizure. But typically those people have epilepsy, or we see signs on their exam. They bit their tongue, they've had urinary incontinence, somebody saw some jerking. Low blood sugar can masquerade like a stroke. So we tell all of our diabetics, yeah, they need to call 911 at just the 5-minute point, but as they're doing it, check their blood sugar. If it's super low blood sugar, it can masquerade like a stroke, and that's a super expensive car ride by ambulance that they could avoid by checking their sugar. Migraine, believe it or not, in people, even sometimes young people, can masquerade like stroke, and that is due to vasospasm. An artery of the brain could just spasm down, and then that can act like a clot, because a clot is just like a plug in a hose. But if that hose just spasms down, then still the distal part of the brain gets no blood flow. It doesn't care whether or not it's blocked by a vasospasm or a clot. A lot of strokes in the young, unfortunately, can happen with illegal drug abuse that causes this process of vasospasm. Methamphetamine, cocaine. So that's in the differential diagnosis as well. Artificial heart valves have to, people that have those St. Jude valves, maybe they had rheumatic heart disease and they got, or rheumatic fever once, and then it went to their heart and they got severe aortic valve disease. They might get an artificial mechanical valve that has metal in it, and then they need massive thinning of their blood for their whole life with these good drugs like Xarelto and Eliquis. Now, when we are at the ER seeing people with TIA or stroke, we can tell some things sometimes by doing the exam. Of course, checking their blood pressure and checking side to side blood pressure. It's supposed to be the same when we feel the pulse here and here, but if one side can't be felt, they might have severe artery disease of their subclavian, and then that steals blood from their brainstem. We love to look in people's eyes when they have these diseases. In fact, we learn the most through people's eyes, I would say, as neurologists. When we look in the back of an eye, we can see clots. That's called a Hollenhorst plaque. Such a person might have had a warning maybe a couple weeks before where one eye just suddenly went black for a few minutes, like a black shade came down over it, and then a few weeks later they have their event where suddenly half their body is weak and they're slurring their speech. That first event they had is called amaurosis fugax, but that's a weird French term, but it implies TIA because it's a transient attack of lack of blood flow, transient ischemic attack. And we kind of consider the retina and the optic nerve and the brain as a single unit. So we're always looking in the eyes for these type of clues. We can see arteries get severely sick from atherosclerosis by looking in the eyes. They start having AV nicking. Arteries become severely narrowed with those type of diseases, and we can see that when we look in the eyes. Now, we want to feel, we want to listen here, okay? Didn't bring my stethoscope, but if we ever hear something here, is that a good thing or a bad thing? It's a good thing to hear something here. Lub-dub, lub-dub. Bad thing to hear something here. It's got another French term called bruit. But if we hear something here, like a whoosh, whoosh, it's a bad thing, okay? It means that artery has become severely blocked, okay? And we talk about this artery just like the Niagara River. So your neck artery is just like the Niagara River. If you listen to it where it's super wide, like a few miles upstream from the falls, and it's going so slow, it's not making any sound. When you collapse it to a point of obstruction, a few miles further down at the falls, it's still quiet. It's the loudest water on earth. And the human body is the same way here at the neck, because the same volume of blood has to pass through a spot that's severely blocked. So it has to really speed up massively to get through this blockage. And in doing that, it creates sound that we can pick up with a stethoscope. So if we ever are seeing patients and maybe they haven't even had a TIA, but we just listen to them at the office, we hear something there, we're getting a workup, things like a carotid ultrasound or a CTA or MRA. Then we see that blockage, and if it's severe, and which it sometimes is, then they need a procedure, which is a cure. It might be surgery. It might be they just get it ballooned open and leave a stent over in Greenville. Uh,
You don't call the Roto-Rooter then?
Roto-Rooter. We could call the punctual plumber. Yes, we could. That happened with my father, and he wound up getting both arteries done within a span of 2 weeks of each other. They just picked the 95% side to do first, and then did the 80% a couple weeks down the road. But anyway, so we can see a lot on physical exam just at the ER. But of course, we need testing, and usually it's kind of late, and we don't have MRI available, but we always want a CAT scan because strokes can be bloody or non-bloody. Now, TIA is not a stroke. Okay, TIA is a warning to a stroke. There really has to be heeded, but if it actually becomes a stroke and their deficit lasted more than 24 hours, so it's a stroke clinically, not just a TIA, well, we have to work that up by getting an image of it. And that's important if we're thinking about TPA, because if a stroke was bloody and we gave this drug TPA, they would die. If there's any blood on the CAT scan with acute stroke, then that means they can't have that cure drug. But we like to get workups very fast at our office, even if it's a TIA of just 1 minute and never even took the person to the ER. And some of the arteries, I've got a little thing I wrote here, but some of the arteries tell us sort of, some of the symptoms that people have tell us which artery is involved. A lot of times it's an artery called the MCA, which is, gives blood to way over here, and but sometimes it's a PCA, which is posterior, and sometimes it's A, or anterior cerebral artery. But the artery, the MCA is unique in that it might be different in a right-handed versus a left-handed person. And the brain is kind of different right to left. Some people with a right brain stroke that are right-handed will have a weird syndrome called neglect. And one hand will be brought in front of them and they'll say it's not a hand, it's a tiger's paw. People that have the left MCA stroke and the right-handed, they suddenly want to say bed, but they say Zed, or they say totally made-up words. And they have also a problem with their vision where they can't see contralateral from where the stroke is happening. If a stroke is going on at the brainstem, it's the only part of the body that can give cross weakness, weakness on one side of the face and the opposite side of the body. So if we see that at the ER, we know they're having a brainstem event, be it either a TIA or a stroke. Now, speech deficits. Slurring of speech has a medical name, dysarthria. The weird type of speech I was talking about is called aphasia, and we would not want to see aphasia. If we see somebody just having little slurring of speech, they could have a tiny stroke called a lacoon, and those are strokes that often are 100% improved when you look at the person 2 months down the road. These big artery strokes is what we fear because they are never 100% improved. Now they can get some improved, but they can't get 100% improved. Okay. Now, I don't like public speaking. I might have a stroke in front of y'all, but I hope not. Okay. Oh, thank you, thank you. Now, strokes in the young. This can happen as well. I just saw one today, this morning, over at the office. It brings up a whole different sort of kettle of fish. And we opened this kettle in this patient this morning. But anyway, we still kind of look for certain things that we look for in every person, their cholesterol, whether they have diabetes or not. But so many people that have that are young that have stroke have had some type of trauma to their neck. Maybe in a sport like judo, maybe skiing, maybe chiropractic, and of course that could happen to anybody. They also often have an unusual state called a hypercoagulable syndrome, and we look for a lot of unusual type of blood labs in that setting. They've got weird names: antiphospholipid antibody syndrome, protein C, protein S, factor Leiden. Oh, I can't even remember them. But we look for a lot of different things when it's a stroke in the young, and which we can see a stroke from the age of 1 day old, unfortunately. There's certain heart conditions, tetralogy of Fallot is one, where somebody could have a stroke in utero, and of course it could happen at any age there is. So stroke is not a age bracket disease, it's anybody's disease, unfortunately. But we do want to rule out things, and migraine and epilepsy is common to mimic as stroke. But those often give positive phenomenon, namely something's moving, not something's paralyzed. With migraine, you're seeing a lot of like zigzag colored lines, bright stars, you know, but that's a positive phenomenon. It doesn't happen with stroke, but it happens with these other conditions, these stroke mimics. Now, I've seen young people that have a triple risk factor combination. Young female nurse I saw a few years ago, but the combination of migraine disorder, smoking, and being on a birth control pill is, that triad is a risk factor for stroke. So if we ever see it, we try to move heaven and earth to get one of those away, because they really need to give that up. It can kill them through stroke, but also lung cancer, heart attack, gangrene. What will they have more of if they give it up? More life, more taste, awful lot more money, more energy. So maybe maybe God gave a migraine, and maybe their OB says they have to be on that pill, but they don't have to do that habit. So I would say that's probably our main focus as far as prevention, is working on things like smoking and cholesterol, blood pressure, and also getting an A1C regulated. Just if it's not regulated, it's a risk factor for stroke. Now, oh, do y'all have any questions? I'm sorry, I'm just droning on.
Like when you go for your regular checkups at the doctor, is it, check your blood pressure?
Oh, no, I think they just do it on one arm at the doctor's office. Now we'll check both arms, you know, at the ER with an acute TIA or stroke, because we're wondering about this syndrome where your artery, it gets real blocked right here. The way we're hardwired by God, the arm, when it's trying to do something, is always going to get its blood supply to it. And there's an artery in the back of your neck called the vertebral artery, which if you have a blocked artery at the subclavian artery, the way we have collateral flow and the way things connect on the inside, when you activate this arm, blood that should be shooting up the back of the neck in a vertebral artery suddenly, say for a couple hours while you're being active with your arm, is flowing down and being stolen by your arm from your brainstem. That can cause a stroke. And that could be cured by this blockage being bypassed with a graft of Gore-Tex. So we work real closely with the vascular surgeons in Greenville on all those type of things. Maybe they need their carotids done, but maybe there's something with these other arteries, vertebral artery or subclavian. Speaking of Greenville, it is a great time to have stroke. Of course, you never want any disease once again, but the doctors, the good stroke doctors at GHS are so good with stroke, they can even get a catheter into the brain to put TPA right on a clot, and then put a retracting device right on the clot and extract it from you. And that's often needed in a feared and often in the past totally fatal stroke called basilar artery migraine. The basilar artery comes to the bottom of your brain and supplies your brainstem, where you have control of breathing and your heart. Strokes in that area often could be fatal, but in this day and age, and with aggressive centers like that, it's a better time if you're going to have a stroke like that to, not just survive it, but even have it cured. So, but anyway, getting back to your question. So yes, but we would look for things like that at the ER. Okay. Now,
Doctor, do you recommend these tests where they do the ultrasound on your veins to be sure there's no blockage?
oh, like at the mall? Well,
No, here.
oh, here, like, I think it's a good idea here because they're looking for this PAD, peripheral artery disease, and that's a bad.
They go here, they go down your arm, they go
Mhm.
the aorta.
No, I think it's yes, I think it's a good thing.
Not you. Okay. You got the words I don't.
But I think it's a good thing, and they can pick up aneurysms of your aorta at your abdomen. But I think it's a good thing. It's good to start with something, kind of cheap and painless, like the ultrasound, before they need to do an arteriogram and catheterize your groin.
If you develop a clot in your leg, would you know it? Would you have any symptoms?
Well, generally you would if you develop it, say at an artery, you would have like maybe some ischemia and some pain. If you develop it in a vein, you could also have pain because you might have swelling and edema, injury fluid. So generally, I think you would know it. The people where they have artery disease, they often have claudication. They used to could walk a long ways. Now they just walk one block and all of a sudden it's kind of becoming cool and hurting. So generally, I think you would know it. Yes, ma'am.
What about when you get a sharp pain in your head and you're thinking,
I wouldn't think so if that's all it was, because there's so much stress in the modern era and everything. Everybody, headaches are super common. But now it's different if you combine that headache with, say, other symptoms. Half your body is numb and you got a real bad headache. There's a disease called temporal arteritis that we worry about sometimes at the ER, where somebody has been having real bad headaches, but maybe they had the phenomenon of, for a few minutes, one eye went black. Also, they sometimes have chewing problems where they chew just a little bit and it causes real severe jaw pain. So, but if it was just headache, I wouldn't be too concerned, except if it's associated with, say, loss of consciousness, high fever, and you can't move your head or neck at all. Those can be signs of a ruptured aneurysm. But I think if it was just somebody that's had headaches before and just has a bad headache, I wouldn't think it was necessarily think that it was a stroke happening.
I had blood clots in my leg. My legs hurted. I mean, it hurted real bad.
Oh, yeah.
I couldn't have walk on it.
Oh, yeah.
So your leg, it will give you problems if you have blood clots.
Oh, yes, ma'am. Did you get, did they put you on medicine for that or do a procedure? Good, good.
Well, they had went to my lungs.
Oh, okay.
And I was just wondering, is that blood thinner, is it as dangerous as they say it is on TV?
Oh, no. Oh, no. It is not. Those warnings are written by government lawyers. Those drugs are safe. How much can we trust the government lawyers? As much as we can throw them. Meaning not at all.
Maybe you went through this and I didn't remember. But what about memory loss? Like just spurts of memory loss?
Mm-hmm. Oh,
Frequent?
well,
Senior moments.
well, Sudden confusion could be a warning sign of a TIA, but generally it would also have something else associated with it, some double vision, drooping of the face, some weakness of a limb. If you're talking about somebody of any age that's just having episodic amnesia, like they're cooking along and then suddenly, and maybe they live alone, but suddenly they don't remember anything that's happened in the last hour, that's more likely to be a seizure disorder, epilepsy. And then, memory loss, then, we'd also worry, are they, having word finding difficulties? If it's more of a chronic memory loss with, say, difficulty working things around the house, TV remotes, and that's called apraxia. You start combining those things, we worry about either MCI, mild cognitive impairment, or even early dementia. So.
You walk down the hall 3 times for this particular thing, you come back again.
What did I go down there for? What am I here after?
That's right. It's the CRS syndrome. Can't remember squat. Oh yeah. Now, how do we treat strokes? How do we treat them? Like the primary docs get involved heavily in risk factor treatment and prevention. But the way that we treat it is we're always wondering, do they need a procedure here at this artery? But also drugs. We do want people that have risk factors like diabetes and whatnot to be on a blood thinner unless they also have bad active peptic ulcer disease, stomach ulcer disease or some reason. But really aspirin is the best medicine ever. It's the first medicine ever invented. It's still the best, not just stroke to prevent, but also it prevents heart attack. There's new evidence that prevents colon cancer, and it can prevent this bad PAD. So it really is the best drug ever and still the first. But we have others. We love the drug Plavix in this day and age. We like a drug Agrinox, but some people it gives headache disorder. We used to only have Coumadin, and now we've got so many other choices if that person has AFib or atrial fib. But we do want people to be on some type of blood thinner and not just kind of wait for a stroke. The reason there is TPA cannot be given at all if you wake up with your stroke. It's a time thing. For all TPA, there's a 4.5-hour window, unless you're talking this hypercritical, but fortunately rare stroke, this basilar artery occlusion stroke. That is so horrible and so horrendous, that window is 24 hours. But they're at a big center by the time that they're even dealing with that. They're over in Greenville. But anyway, we need a blood thinner because a lot of people do wake up with their stroke. And if they do, they can't have this drug called TPA, which is given here, by the way, to people that need it, and then they get shipped to the neuro ICU at Memorial Hospital. So we don't want to even take that chance. So that's why we want all of our patients that have even just one risk factor to be on some type of blood thinner to guard against that episode of waking up with your stroke. You just want to wake up with your spouse, not with stroke. Now,
You don't have a spouse, you do.
well, then we need a dog scan. No, cat scan. No. Okay.
Yeah, you were saying one of the risk factors was your cholesterol. Now,
Oh yes.
how low should you keep your cholesterol prevented?
Well, we give real tough numbers to the other providers. We like the LDL under 70, triglycerides under 150, total cholesterol under 170, and HDL normal. Those are real hard numbers. But if they're achieved, then it's a great thing, because if they're achieved, it lowers.
So you want the bad cholesterol below 70?
Yes.
Can't get there.
Well, at least under 100. Okay. I'll make a deal with y'all. But yes, the Southerners are, maybe at increased risk for stroke because we got you know, the places that serve that food, like Bojangles, the fried foods.
Fried chicken we just had for lunch.
Just a few years ago, you had Jesse Helms up there in North Carolina with all the cigarette subsidies, you know, so the South has been known as the stroke center of the country. Oh yeah, yeah. Oh yeah. Oh, but anyway, we try to cut down on this rate of stroke, okay, and we do have a lot more treatment for it now than say ever before.
It's always been my biggest one.
Oh, I got a joke for y'all. There's a big nest, and in it is a chick on one side and a big orange on the other. Big Orange, that's a shout out to Dabo, by the way. Go Tigers. But do you know what that chick said about that? Look at the orange mama laid. That joke is jamming. No. Oh,
Dr. Sherrill, I have one more question.
oh, sure.
If you wake up with a stroke, are the effects irreversible?
Are the effects reversible? Now, well, strokes can get better. The way we're made by the big man upstairs, strokes get better because, well, it is different from the liver. You cut out half the liver and look at it 2 months later, it's a full liver. When you look at a stroke on down the road, it's always there, okay? But the brain around the stroke tries to make new connections called synaptogenesis, which can occur at any age. If it makes enough of those, and it can take a long time, even a year or so, but if it makes enough of those, the person can definitely get better. Now, it's a size thing. People that have the little strokes, they can, you know, get 100% better pretty quickly. If it's a massive stroke, they can still get better. Now, but these massive strokes, we're generally going to see them have some type of deficit permanently, but maybe not, and usually not, the same deficit that they had in the first week of stroke, okay? So, oh.
What would you say the numbers were for cholesterol, HDL, and LDL?
Oh, HDL is just supposed to be over 40. So, but LDL at least under 100. We really like it under 70. Yeah. But now, if you wake up with your stroke, you just can't get the TPA. But there's still a lot of you know, rehab that can be done, a lot of therapy, and that helps a lot.
Right now I'm on blood thinners, I'm on hormones, but
Oh yeah.
because
Oh, you did throw blood clots. Okay, sorry.
little ones in my lungs.
Oh yeah. Oh yeah, that's a great drug. Yeah. With what? Oh yeah, yeah.
And I did not know until I got here to the nurse. And the very first question the nurse said, "Who's your doctor?" I said, "I thought I had the flu.
Oh really?
I had it all week."
Oh
By
no.
Saturday morning, it was like I wasn't getting better. And I had my daughter take me. I said, "You ever been to the emergency room?" I said, "What's going on here?" I never felt that. Have you ever heard of anybody else that had it? I mean, the way you were doing this, it was like.
Oh no, I've heard it can be real subtle. I've heard of people have it and not.
Because I had no idea.
Thank y'all.